And China has stepped directly into that vacuum.
They have. They've positioned themselves as a super hub capable of offering a full spectrum of care. They've built an infrastructure that handles everything from basic outpatient procedures to the most advanced CAR-RT cell therapies for aggressive cancers. They are bridging that gap between speed and affordability.
But walking into that system as a complete outsider is incredibly daunting. I mean, the report states there are nearly 36,570 hospitals in China.
It's an ocean.
It is. So to make sense of this landscape, we really have to decode the pyramid. China organizes its healthcare infrastructure using a strict 3-tier, 10-grade classification system.
Right.
And the absolute apex of this pyramid, the undisputed top of the top, is known as Class 3 Grade A.
Or Sanjia hospitals.
Sanjia, exactly.
And these Sanjia hospitals are where the concept of scale completely redefines medical expertise. There is this ultimate unspoken rule of surgery, which is that volume equals quality.
Volume equals quality. I like that.
It's true. Chinese public hospitals handle an astounding 83.9% of all outpatient visits and 81.5% of inpatient admissions nationwide. Because of this massive population base, the clinical volume is unparalleled anywhere else in the world.
Meaning a chief surgeon in a top Sanjia hospital might perform more complex cardiovascular interventions or neurosurgeries in a single month than a highly respected Western surgeon might perform in 5 years.
Easily. They develop this surgical muscle memory at a relentless pace. When you are dealing with millimeter precision procedures, that sheer clinical volume translates to extreme technical proficiency.
The reps matter.
The reps matter entirely. The complication rates drop simply because the surgical teams have seen every possible anatomical variation and intraoperative crisis hundreds of times over.
But there is a catch.
There is a big catch. Because this public system is fundamentally built to process the masses, it can be an incredibly harsh, unforgiving environment when it comes to the patient experience. The focus is entirely on clinical outcomes, not comfort.
Right. So for foreign patients who require a softer touch or who simply cannot navigate the sheer chaos of a public mega hospital, there is the private alternative. This tier is defined by clinics holding JCI certification.
Which is the Joint Commission International.
Yes, the JCI is a global gold standard for healthcare quality. And these clinics operate completely differently from the public system. They offer what is essentially a 5-star hotel experience.
But the JCI accreditation isn't just about luxury. It represents strict adherence to Western medical compliance. It means meticulous attention to infection control protocols, aggressive pain management standards, and absolute patient privacy.
Which is a stark contrast.
Oh, completely. In a public Chinese hospital ward, it's actually standard practice for family members to provide bedside care, including feeding and bathing the patient. But in a JCI clinic, you have dedicated, highly trained nursing staff handling all of that, mirroring the standard of care you'd expect in a top-tier private facility in London or New York.
And then, interestingly, between the massive public Sanjia hospitals and the private JCI clinics, a third, highly strategic option has emerged: the hybrid model.